When you were born, you were assigned a sex at birth, which is what you notice on your birth certificate. Female if you have a vulva, male if you have a penis, or intersex if you have a variation of internal and/or external sex anatomy. A person's sex anatomy includes the external anatomy, what you can notice on the outside of your body, and the internal anatomy, which includes your reproductive organs. Remember that sex assigned at birth is different than your gender identity. Sex is the label you received at birth based on what your genitals look like, and gender identity is a feeling and knowing of oneself, of being a boy, girl, both, neither, or another gender. Let's take a closer look at the external sex anatomy of a person assigned female at birth. The vulva is the outer part, and it includes the MONS pubis, the labia, the clitoris, the urethra, and the vaginal opening. The MONS pubis is a squishy space that protects the pubic area. Following puberty, it may become covered in pubic hair. The labia, also known as the lips of the vulva, are folds of skin that cover and protect the vaginal opening. There are two sets, the outer labia and the inner labia. Labias come in different sizes and colors. No two are the same. The clitoris is a tissue located right at the top part of the vulva. The clitoris is much larger on the inside of the body. Externally, only the glans clitoris is noticeable. It can be as tiny as a pencil eraser or as large as a baby carrot. Every clitoris looks different. It is very sensitive to touch, and it only has one purpose: to give pleasure. The urethral opening is the hole where urine or pee comes out of, and it's located just below the clitoris. The vaginal opening, or the vestibule, is located right below the urethral opening. This is the space where babies and menstrual blood leave the body. It's also the site where vaginal sex may take place. Right behind, you can find the anus, which is the opening to the rectum. It is also the site where anal sex may take place. Now, let's go inside and discover the internal sex anatomy of a vulva owner. The vagina is an elastic and muscular tunnel that connects the vulva with the cervix and the uterus. People often confuse the word vulva for vagina. The vulva is part of the external sex anatomy, and the vagina is part of the internal sex anatomy. The ovaries are two nest-like organs that store eggs. They release one or more eggs each month, which travel down the fallopian tubes to the uterus. They are also responsible for producing hormones, which are some of the special chemicals that make your body do different things, like grow with puberty, make babies, or menstruate. If an egg is fertilized, a person may become pregnant if and when they wish to have a baby. If not, the lining of the uterus sheds through the cervix and out of the vaginal opening, which is what we call a period. As you grow older, you will notice many changes in your body. It's all just a part of growing up. Remember, there is no such thing as normal. Your body is uniquely yours.